In this video, I'm going to talk to you about lumbar stability and the core. So the core muscles are made up of multifidus, which sits in this gutter here, right next to the spinous processes. They're on the left and the right, and they travel all the way up the spine. So for the lumbar stability, between L1 and L5, we're interested in multifidus running up here. We also have a muscle that attaches from the back, wraps right around the abdomen and comes back to the other side of the lower back. This is transversus abdominis, and the muscle fibers travel horizontally. So you can imagine as they contract, it's a bit like a corset or a belt. It tightens up and constricts the abdominal cavity. On top of these two muscles, we have the pelvic floor muscle, which sits at the base here, so the floor of the pelvis, and we also have the diaphragm, which is way up here, moving up and down, which causes breathing. So the contraction of the diaphragm, the pelvic floor, the transversus abdominis and multifidus, all four together, increase the pressure of the abdominal cavity, or the intra-abdominal pressure. And it's been shown that intra-abdominal pressure helps to stabilize the lumbar spine, so hold it still, and also helps to unload the lumbar spine. So during movements such as flexion, extension, and side flexion, they've shown that it can decrease the compression through the spine by up to 20 to 30%. It's important when we train the lumbar spine stability to not try and get our patients or our clients to fix their lumbar spine by contracting their muscles around really tight and then moving with a rigid lumbar spine. That's not how we are supposed to train core stability. The spine is made to move left, right, flexion, extension. So we need to be able to contract these muscles to a point and still move while contracting. That's the basis of stabilizing the muscle through normal movement, such as gardening, playing sport, and your activities of daily living. So the question is, when do we train somebody to stabilize the lumbar spine with exercises? Because most people don't have an issue with it. Some MRIs you can see a segment that is over-moving. You can get bony edema, swelling through the bone, a degenerative disc, or some extra wear and tear in the facet joints. Some patients even have one vertebra that slipped forward, known as a spondylolistheses, more common down in the bottom two segments. And there are also some patients who have a crack through their spine, pars defect. You can have a pars defect on one side, you can have a pars defect on the other side. At the same time, if they're both broken at the same time, then the vertebra can slip forward. That's another case of a spondylolistheses. So when these extra movements can occur between the vertebra, that's when we need to concentrate on teaching the patient to stabilize and improving their muscle function to compensate for the lack of passive stability. So the passive stabilizers are the ligaments, the bones, and the cartilage. So improving muscle function can help to overcome some of these inadequacies in the spine. Thanks for watching.